Oklahoma right now ranks 48th in the nation in health indicator outcomes, and we're too good of a people to have such poor numbers as it relates to our health.
Studies have shown that if there's availability and accessibility to shared use programs in schools and other venues, people are 38% more likely to exercise and participate in a healthy lifestyle. That's good for Oklahoma, individually and collectively.
The state budget itself is affected by the health of our citizens, and of course our workforce is affected by the health of our citizens too, because if people aren't healthy, then they're less productive as a workforce. It's unacceptable that we're so unhealthy as a state, and one of the ways that we can help is what's called a shared use agreement. Basically what it does is it limits the liability of schools and facilities and public places to where the public can go in to utilize that type of exercise equipment or just enjoy the great outdoors after hours.
I reflected upon, even as a teenager, when my grandfather had a heart attack. There was nothing but dirt roads and gravel. And so walking as exercise, which is what his doctor prescribed, was really not feasible. So he'd get in his car, and in the summers we would go with him at times, and go to the local high school that had a track, and it was open to the public for them to use. That saved his life. He lived for about 20 more years on a really bad heart. That community and that school worked together to keep that track open, which is why it's so important here in Oklahoma, especially in rural areas, that schools have open facilities for their community members.
I grew up in a time when smoking was popular, people didn't exercise as much, they ate a lot of fried foods, and so at the early age of 56, my dad started developing cardiac problems. He had triple bypass surgery, and he died by the time he was 57. And it was such a shock that I would lose my father at a very young age. So we want to do what we can do as a state, as public policy makers, to create the right type of atmosphere to where Oklahomans will work on improving their health.
By giving people access to the playgrounds, to these shared spaces, we're meeting them where they are. It's one of the things we want to do with the American Heart Association, is meet people where they are.
This is how education is supposed to be. The center of a community ought to be the school. Our community has invested millions of dollars in our facilities. That kind of investment that our community's made needs to be not only used from 7 o'clock in the morning until 3 or 4 in the afternoon. That needs to be used on the weekends and in the afternoon after school's over. I see this as an important way for our community to really come together.
Because it is public funds that builds these types of facilities. You know, the school itself is a part of the heart of the community, and so why not be able to have adults and other kids be able to go back to the school after hours and be able to enjoy the facilities that we as taxpayers have invested in.
This is a safe place that kids can come. It's a known place, the center of our communities, and to have them open after hours is really key. Not only for people to feel comfortable in coming here because they know it, but also to help them lead healthy and active lifestyles. That really inspired me to take part in helping people change their lives.